Okay, welcome to Gua Sha Module 1, the multiple choice questions. Number 1, which classical Chinese medical text dating back over 2,000 years first documented early forms of scraping therapy that would later evolve into Gua Sha?
Wang Di Neijing, number one.
Yeah, the Yellow Emperor's Inner Classic. In the traditional nomenclature of Gua Sha, the character Sha specifically refers to which of the following physiological phenomena?
The transient erythema or
Petechiae.
petechiae appearing after
Petechiae,
treatment.
yeah. That's petechiae, okay? Appearing.
Petechiae.
That's the term for the erythema.
Petechiae.
Yeah, that's the Sha.
Erythema.
So pinapalabas natin yung Sha. Number 3, which of the following materials was not historically recorded as a tool for Gua Sha in ancient Chinese households?
Stainless steel.
Of course. Number 4,
Yes.
according to TCM theory, which pair of external pathogenic factors is explicitly targeted for release by Gua Sha during the early stages of a common cold? In other words, kung may common cold, if you have common cold, these are the two external pathogenic factors that we want to release. Or,
Wind and cold.
yeah, wind and cold, of course. Number 5, the meridian pathway most commonly engaged during a Gua Sha session aimed at alleviating lumbar pain is the
Is the bladder channel.
bladder channel. Which modern therapeutic modality directly incorporates the scraping principle of Gua Sha, but utilizes instrument-assisted soft tissue mobilization, or IASTM, technology?
Braston technique.
Which
One.
therapy is described as leaving circular red-purple cup marks rather than linear ones?
Cupping.
Of course, we call this ventosa in the Philippines. The term
Yes.
Chao Chio is the Vietnamese equivalent of Qua Sha. Translating literally, it most closely means,
To scrape the wind.
well, scrape the wind. Which of the following modern skincare tools is not traditionally employed in facial gua sha practices?
The wooden massage stick.
Yeah, baka masira pa yun. Within TCM, the phrase, where there is stagnation, there is pain, underpins which primary therapeutic objective of gua sha?
To move stagnant chi and blood.
Which historical Chinese dynasty is not explicitly mentioned as a period during which gua sha originated or was practiced?
The Tang dynasty.
In the modern sports recovery context, gua sha is most frequently combined with which of the following physiological processes?
Promoting microcirculation.
Of course, which of the following conditions is least likely to be a primary indication for gua sha in TCM?
Acute myocardial infarction.
Yeah. The temporary discoloration, the Sha, is interpreted as stagnation being released. Which of the following best describes the underlying TCM concept of stagnation?
Stagnation. So, accumulation po ito. Accumulation of black chi and blood in meridians.
Great. Among the listed modern applications, which one specifically emphasizes temporary lifting effect as a claimed benefit of facial gua sha?
That
Temporary, so that means you have to do it forever.
the temporary lifting effect.
Yes. Of course, nandun na pala yung sagot. Which of the following is a distinguishing feature of gua sha when contrasted with massage?
Production of peti-
Petechial.
petechial marks.
Yeah. The Wei Qi is best described as
The defensive chi that protects the exterior of the body. Wei
which
chi.
of the following modern scientific mechanisms is not a way gua sha may relieve chronic pain?
directly increasing serotonin synthesis in the brain.
In the context of Gua Sha's cultural evolution, which Southeast Korean country refers to its version of the therapy as Kerokon?
Indonesia,
Which
for China.
TCM organ system is most directly associated with the liver meridian, a pathway commonly treated with Gua Sha to address emotional stress?
The liver,
Which of the following tools is least likely to be used in contemporary professional Gua Sha practice?
the bamboo spoon,
The term microcirculation in modern research on Gua Sha most closely refers to
perfusion of capillaries and small vessels in the dermis.
which of the following statements best captures the philosophical significance of Gua Sha in traditional Chinese culture?
Mm, it reflects the harmony between humans and nature preventive health.
The heat pathogenic factor in TCM is most likely to manifest as which of the following signs that Gua Sha aims to alleviate?
Heat, so this is profuse sweating and fever.
Which of the following is not among the common treatment areas for modern wellness practitioners using Gua Sha?
The lower legs,
Yeah, mostly kasi sa ano siya, di ba? Rarely lang ginagamit sa lower legs. Imagine gamitin mo sa leg then sa mukha na naman. Okay. The comparative analysis, which therapy is described as usually no marks and primarily utilizes kneading manipulation.
massage.
Twina, yeah. The backshoe points are mentioned in relation to which meridian channel that Gua Sha may stimulate for organ influence.
The bladder channel.
Which of the following historical uses of Gua Sha predates the development of formal acupuncture points?
The treatment of fever and colds at home.
The Sha marks typically fade within what time frame?
2 to 7 days.
Which modern therapeutic field explicitly incorporates Gua Sha principles for fascia release?
Physical therapy.
Which of the following is identified as a pathogenic factor that Gua Sha helps to expel?
To expel the dampness.
The Grafton technique is best classified as
Uh, Instrument assisted soft tissue mobilization method.
which of the following best explains why Gua Sha is considered family-centered healing historically?
Because it could be performed with simple household items by non specialists.
Wind, cold, heat, and dampness are cited as external pathogens. Which of these is traditionally associated with sudden onset of headache and aversion to cold?
Wind.
Which modern spa treatment most closely mirrors the traditional Gua Sha objective of opening the meridians?
Body scraping with jade tools.
Which of the following is not a claimed benefit of facial Gua Sha?
Permanent wrinkle removal.
So you have to use Gua Sha all the time. O, hindi siya
Yes.
paulit-ulit siya dapat. The practice of Kerokan in Indonesia is most analogous to which Chinese therapy?
Gua Sha.
Which of the following statements about the Wei Qi is correct?
It is defensive chi that protects the exterior of the body. Number 2.
In the context of Gua Sha, stagnant Qi is most likely to produce which symptom according to TCM theory?
Joint pain.
Which of the following is least likely to be a modern scientific explanation for the pain-relieving effects of Gua Sha?
Most likely. So, direct DNA alteration in skin cells.
The Bakshu points are primarily located on which anatomical region?
Back,
Which of the following is not a material mentioned as a modern Gua Sha tool?
glass. Yes, glass.
Okay. The temporary red or purple spots observed after Gua Sha are medically known as
Uh, pet, ano nga
petechiae.
to? Petechiae.
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 Petechiae. Mm.
Petechiae.
Petechia ang singular, petechiae. Petechiae. Which of the following best describes the difference in pressure direction between Gua Sha and copying?
The Gua Sha uses repeated strokes in one direction. The cupping uses suction to lift tissue. Number two.
In the modern wellness industry, Gua Sha is often marketed for lymphatic drainage. Which physiological system does this refer to?
Lymphatic system.
Which skin manifestation is most commonly associated with heat in TCM?
Heat. So this is red or inflamed skin.
Which of the following is a primary therapeutic goal of Gua Sha that distinguishes it from massage?
To create petechial marks indicating stagnation release.
In which historical period did the Han Dynasty predominantly exist?
Uh, 206 BC to 220 AD.
Wow, okay, 206 BC. Which modern therapeutic technique specifically combines traditional scraping concepts with contemporary sports medicine?
Okay, Graston technique.
Which of the following is least likely to be an emotional benefit attributed to Gua Sha in TCM?
Promotion of melancholy.
Okay. The term Sha is sometimes interpreted as to release toxins. Which of the following modern scientific concepts aligns most closely with this interpretation?
The clearance of metabolic waste via lymphatic flow.
Which of the following statements about the stagnation concept is incorrect?
Mm, Stagnation refers exclusively to mental confusion.
Which therapy is noted for usually no marks and a primary purpose of harmonized chi and blood, relaxed tissues?
Massage. No
Which of the
marks.
following is not a traditional tool for Gua Sha?
The bamboo stick.
Which of the following best explains why Gua Sha marks fade faster in individuals with robust circulation?
Accelerated hemoglobin breakdown and removal.
ISTM, ISTM is instrument-assisted soft tissue mobilization. Which of the following is a primary biochemical effect of ISTM?
Yes, some mechanical stimulation.
Yes, of fibroblasts. In TCM theory, the liver meridian is most closely linked to which emotional state?
Anger.
Which of the following modern health trends is least directly associated with Gua Sha?
Uh, Ketogenic diet.
Okay. Which of the following processes is not a claim mechanism by which Gua Sha supports immune function?
Direct stimulation of white blood cell proliferation.
Na pinapadami yung white blood cells. The meridian concept in TCM is primarily analogous to which of the following in Western anatomy?
Lymphatic channels.
No.
No. Connective
Connective
tissue.
tissue
Fascia.
fascial
Fascial plane.
planes. So sa Western anatomy, the meridian concept is actually about fascia, connective tissue fascial planes. Kaya meron siyang, may connect siya. Okay. Which of the following signs would most likely indicate wind as a pathogenic factor in TCM, warranting Gua Sha treatment?
Wind. So this is sudden onset of itching and hives.
Stagnation being released as an interpretation of Sha marks is cited. In physiological terms, this may correspond to which process?
Uh, Release of trapped interstitial fluid.
Yeah. Which of the following is not a modern material used for facial gua sha tools?
Tungsten carbide.
In the historical spread of gua sha, which of the following countries is not listed as having adopted a version of the practice?
The Japan.
What is the primary purpose of adding fire to cupping?
To create vacuum by heating the air inside the cup.
Which of the following therapeutic outcomes is shared by both gua sha and cupping?
Promotion of microcirculation.
Which of the following is a core TCM concept that underlies the preventive use of gua sha?
To maintain smooth flow of qi and blood. Maintaining. Number two.
Which of the following is not a typical indication for gua sha in TCM?
Chronic hypertension.
The wind pathogenic factor in TCM is most commonly associated with which of the following symptom patterns?
Sudden chills and fever.
Which modern therapeutic application of gua sha is least likely to involve the use of lighter pressure and slower strokes?
For the sports recovery. Number two.
The term stagnant qi and blood is linked to which of the following clinical manifestations?
Pain and stiffness.
Which of the following is not a therapeutic function of gua sha?
Increased bone density.
Heat is a pathogenic factor. Which of the following conditions would gua sha most appropriately address under this classification?
Heat, so fever and sore throat.
Which of the following tools is specifically associated with ceramic material in traditional gua sha practice?
Ceramic. So scrapers too.
Scraper spoon. Which of the following statements correctly reflects the distinction between gua sha and massage, tuina, in terms of visible skin changes?
Number two. Only gua sha typically produces visible decay.
Petechiae. Removing dampness is a goal of
PTA.
cupping. In TCM, dampness most often manifests as which of the following?
As swollen and heavy limbs.
Which of the following modern clinical forms combines traditional scraping concepts with contemporary sports medicine?
The Dresden technique.
The temporary redness after gua sha is said to fade in 2 to 7 days. Which physiological process primarily determines this time frame?
Hemoglobin degradation and resorption.
Which of the following is not a modern benefit of gua sha in the wellness industry?
Not a modern. Enhanced cognitive function.
The Bakshu points on the bladder channel influence internal organs through which mechanism?
Through meridian organ correspondence.
Which therapy is indicated for deep muscular tension as a primary use?
Deep muscular. Uh, Cupping.
Yes. Which of the following modern tools for facial gua sha is most likely to be made from a mineral rather than a metal or synthetic resin?
Mineral. So this is rose quartz tool.
The term qi in TCM is most accurately described as
Vital life energy.
which of the following cultural concepts is not a part of gua sha's historical significance?
Um, Not a part. So royal endorsement by emperors.
In the modern clinical context, gua sha is least likely to be employed for which of the following conditions?
Acute infection control.
Which of the following statements accurately reflects the relationship between Gua Sha and detoxification?
Gua Sha promotes movement of toxins to the skin surface manifested as Sha marks.
The wind factor in TCM would most likely be addressed by which of the following Gua Sha treatment locations?
Wind factor. Lung meridian on the chest.
Yes. Which of the following is not a benefit of facial Gua Sha?
Permanent skin tightening.
The Graston technique utilizes what type of instrument to achieve its therapeutic effect?
Stainless steel scraping tool.
Which of the following is least consistent with the TCM principle of moving stagnant qi and blood?
Using rapid random tapping motions.
The term stagnation most directly correlates with which modern physiological condition?
Venous insufficiency.
Which of the following is not a traditional use of Gua Sha?
Chronic kidney disease treatment.
The lingual or lung meridian is most associated with which of the following functional outcomes of Gua Sha?
Lung. So this is supporting respiratory health.
Which of the following is a core TCM concept that Gua Sha aims to influence?
Influence smooth flow of qi, blood, and body fluids.
Which of the following modern research findings about Gua Sha is not mentioned?
Improve of bone mineral density.
Based on TCM anatomy, which organ does the hair or Kang meridian correspond to?
Liver.
In the modern adaptation of Gua Sha for beauty, which of the following processes is most likely to be enhanced by the use of jade tools?
Lymphatic drainage.
Which of the following statements about cupping is incorrect?
It generally does not create visible marks because it can create.
Yeah, kasi it creates. Okay. Which of the following describes the cold pathogenic factors, typical presentation in TCM?
Cold. So tingling, chills, and aversion to cold.
Which of the following modern health modalities is least directly linked to Gua Sha?
Dental orthodontics.
The therapeutic functions of Gua Sha include all except which of the following?
Except increased bone remodeling.
Which of the following historical tools for Gua Sha is made from an animal product?
From animals. So buffalo horn.
Which of the following is a primary purpose of cupping as opposed to Gua Sha?
To lift tissue through suction.
Which of the following is not a modern tool material for Gua Sha?
Plastic.
Yeah, masakit ang plastic.
Sakit yun, hindi dumudula.
The wind factor in TCM often affects which of the following body regions most prominently, making it a target for Gua Sha?
Head and neck.
Which of the following best describes the modern clinical form? Instrument-assisted soft tissue mobilization, IASTM.
Mechanical. Scraping to mobilize soft tissue.
Which of the following is not a traditional family-centered remedy used alongside Gua Sha?
Herbal teas.
Yeah. Which of the following best illustrates a difference in tool material between traditional Gua Sha and modern facial Gua Sha?
Traditional use jade. Modern use rose quartz.
Which of the
Mahal na kasi yung
following is
jade.
the primary physiological effect of Gua Sha that contributes to detoxification?
Detoxification. So promotion of microcirculation and lymphatic flow.
Which of the following is least likely to be considered a pathogenic factor in TCM?
gravity.
Congratulations. Perfect.
Yeah.
One mistake? Okay.
Maybe three,
Okay.
four,
Yeah.
or
Thank you so much, Ma'am Kizaya. See you in module 2.
five.
Thank you
So,
thank you very much.